Hello and welcome. My name is Calliope and I'm one of the ARNPs at this clinic. How you doing today? Yeah? How are you finding our little rural clinic here so far? Yeah, I haven't seen much just yet. Well, I hope by the time you leave this exam, you feel even just the littlest bit better. So, you are a new patient. So I have a couple of questions for you. Can I just have you confirm your name? Then I know how to say it. Okay. Good. And your date of birth? Excellent. And is that the name you prefer to go by? Do you like a nickname or anything like that? Okay, let me just note that. Excellent. So, new patient exam. I am going to be a little bit all over the place here, because I need to get to know you, how your body works, what's normal for you. So we'll start at the head and just work our way down. And I'll take notes along the way. And we'll make up a little comprehensive report about you and what's healthy for you. So I'd love to start by looking at your scalp and your head, if you don't mind. Okay, so let me just start right here. And we'll just look at the edges. Good. So this examination is as much for me getting to know you as it is you getting to know me. See if it's a good fit for you. We do have other clinicians. If the vibe just doesn't jive, and that's okay. Just gonna come along the back here. We want to make sure that you're comfortable, because your medical professional is someone you don't want to feel like you need to lie to or obfuscate anything. You don't want to feel embarrassed. You want to feel like you can come to them with what's important to you and things you are worried about. And you want to feel like you're being listened to. Okay, so in looking through the hair here, I'm not seeing anything out of the ordinary. So I'm going to palpate along and just make sure our contours where they should be. That everything is shaped like it should be. Okay. Any pain or tenderness as I'm palpating here? Okay, good. So let's jot a few notes down. There'll be some more notes here because this is the first time I'm seeing you, so I don't know yet what's normal for you. And these notes will help me for next time. And let's do a little skin inspection here. So I'm going to grab my magnifying glass and my light. But we're going to start just by looking at the skin and doing a bit of palpation. So, did you move to the area, or were the family medicine facilities a little filled up around your area? Okay. Interesting. I'm just gonna feel around the skin, feel the texture very gently here. Have you found anything that you really like so far? Yes, it seems to be rather slow living, but there's actually quite a few things that are always going on, and people love to be nosy, so everyone's always got a story or news to share or just some little goofy anecdote. Okay, so I'm just going to go in first without the light and just look at your skin. There we go. So, one thing that I really enjoyed when I first came here was the amount of wildlife. And funnily enough, just last night, so I live in a forest, and I was sitting on the steps with my partner, and just gonna get a little bit of light here. And we were chatting. It was real dark. We had just the porch light on, and we have a big old buck walk up on us. And we didn't notice because we couldn't see in the dark until the porch light got the contour of said buck, and it was big. So it was very quiet, just stepped up on us and went into the forest to bed down for the night. And just that afternoon, we had a hawk swoop down. We had turkey vulture, and a groundhog was trying to avoid both of them. So he was just ambling on the sidewalk. And the other day I found a fox in my backyard. And I tried to get a picture, but they saw me. They saw me approach the window, so. And a few weeks before that, there were a bunch of does in my backyard. So, never quiet here. So, just want to double check here. So I'm not noticing anything out of the ordinary. I just want to double check the texture in a few areas. But yeah, that part is entertaining on its own. So if you pay attention, you'll probably see quite a bit of wildlife. Now, there's a lot of barred owls around, so you'll probably hear them. They're quite loud. And then you gotta watch for raccoons. A lot of raccoons out and about. I'm gonna take a look at your eyes. Just gonna use a light real quick and just look at them. This little bit of light. So, there's a tree front of my house that is apparently the raccoon fighting tree, because I've had to go out there and flash a flashlight at a bunch of big old raccoons the size of a corgi that are fighting in the tree. They love to get up on the grill, they love to get up on the trash cans, and just duke it out. So, you want to make sure that you might want to keep like a brick or something on your trash, because they will rifle through, get any food that you don't have secured. Okay, good. So, just want to double check here. So, our lacrimal glands and our sclerae, eyelashes, eyebrows, irises, pupils. Okay, I'm just gonna have you look up for me. Good. And look down. Okay. Look down. Good. And look up. Look up. Good. Okay. So that's our little inspection there, and then we're going to want to do some pupillary tests. But yeah, don't be surprised if all of a sudden people are real friendly to you. I like seeing new people. So I'm going to have you just look at my nose right here. Love to see new people. And you'll probably have someone just wander over and start chatting you up. Just real quiet. Okay, just keep looking at my nose. Mm-hmm. There you go. Good. Okay, so pupillary response is normal. We have equal, round pupils that are reactive to the light. So I'm going to have you just look right here, and I'm going to have you follow this without moving your head here. So we're going to go in and out, in and out. Okay, right here, in, out, in and out. Okay, so our eyes also accommodate. So we have our PERRLA acronym all sorted. Let's look at how your eyes move. Okay, so I'm going to have you just follow this finger to only your eyes without moving your head, okay? Alright, so let's bring you right up here. Good. And here. Okay, right here. Good. Okay, and side here. Side. Up. Down. Right, let's do the H test here. So over and up. Down. Over. Up. Down. Right in the middle. Okay, up. Down. Up. Down. Okay, so no lid lag there. We have noticed that. Okay. Yeah, quite a few people like to be pretty chatty, but there are a lot of people that keep to themselves as well. If you want to be social, there's plenty of people to be social with. If you don't so much, that is not out of the ordinary at all. Okay, so go ahead and just look straight ahead for me. Right? We're going to look at your direct consensual response. Direct consensual. Consensual. Direct. Direct. Consensual, good. Direct. Consensual. Direct. Direct. Direct, good. Consensual. Consensual. Okay, good. So, direct consensual response is normal. So yeah, if you couldn't quite tell, I tend to be one of the yappier nurse practitioners in the building. Yap God, love to chat about anything and everything. So let's take a peek at your ears. And we'll just do a little look-see here, a little looky-loo. Keeps me on task to be able to talk so much. Otherwise I'll get distracted. Good. Okay. Oh, just look behind here for a moment. Okay, no lesions behind the ear. This side as well. Good, okay. No, not so much. Alrighty. So, do you have any pain in your ear at all currently? Okay, so we're good to bring out the otoscope then. Okay. And I am just going to pull up and back here. And we'll look in the ear canal. Let me know if there's any pain at all, any tenderness. I'm just going to stay right here, but we want to make sure that that's not painful either. Okay, clear the ear canal, the debating membrane. Okay, and that looks all good. Luckily, this is a fairly small area to work with. Only a couple centimeters, few centimeters. There we go. Okay. Is that comfortable there? Yes. Alright. So, yeah, there's no irritation here. Nothing wrong with the debating membrane or the ear canal. Got our landmarks. Everybody looks great there. Okay, that's good. So, have you received a hearing exam, hearing test anytime lately within the last few years? Okay, good. So we'll just do a little simple one here. I'm just going to whisper in one ear or the other. if you could just tell me what word you hear. All right? Okay. Island. Tapestry. Peony. Golden. Mist. Wood. Arch. Zip. Stick. Spice. Satin. Oblique. Foam. Woven. Plastic. Upper. Chair. Bronze. Okay, did all of those come in fairly clear for you? Fairly clear, yes. Okay. Let's jot that down and then we'll just move right along for you. I'm quite pleased so far with what we've got going on. That's cranial nerve number 8. Otoscopy. There we are. Good. So let's move on to the nose, mouth, and throat here. Just grab our couple of tools. Alright, so I'm just going to use my light here and we're going to look inside your nose if you don't mind. Okay, just tip your head back a bit. There we go. So, in the spirit of being a yap master, yap god here, I came across a very interesting article a couple days ago. Okay, you can go ahead and put your head down there. Go ahead and I'm just going to feel around the nose here. Interesting article about somewhat about human evolution, although way far back from when the human genus was even thought of. Is this tender at all? Okay, I'm just going to tap on your sinuses. Let me know if that's tender at all. Just tapping along here. Okay. So, the things that distinguish humans from other animals and really other hominids, hominines, that sort of thing, the great ape family, right? There are certain characteristics that separate us. Okay, is that all good? Alright, let's grab a little feel of your lymph nodes here. So, it's things like having big brains, being bipedal, obligate bipeds, which we stand on 2 feet at all times, and things like non-honing or non-self-sharpening canine teeth that are small, monomorphic, so it's present across all people. Okay, just right down in here. We're just going to work our way back. And a sophisticated tool culture, that kind of thing. And the question is always, what develops first and when did it happen? Okay, we're just going to come along the neck here. So, there was this article about a fossil found in Bulgaria that possibly shows bipedalism in a Miocene ape. So, okay, lymph nodes are all good. Let's just jot that down. Lymph nodes and sinuses. So the Miocene is, in English, it's epic, but I always get tripped up because I really enjoy La Belle Époque, which is French, and very similar words. So I always want to say epoch, but in English it's an epic. Okay, and lymph nodes here. So we are currently in the Holocene. That started less than 12,000 years ago. Before that, you had the Pleistocene. Let's look at your mouth here. I'm just going to look at the lips to start. You have the Pleistocene, which is generally known as the Ice Age. Before that, you have the Pliocene, and then you have the Miocene. So, when we're talking about the Miocene, we're talking about like 7 million years ago. Genus Homo has been around at the earliest, like 3 million years. Currently, our oldest fossil is 2.8 million years old, 2.7, 2.8. Okay, so I'm going to have you open your mouth here. I'm just going to poke around so I can see the whole oral cavity. So, that's a big difference. 7 million years. I think this fossil that was found was 7.2 million years old. And then the start of genus Homo at the earliest, 3 million years. So, before genus Homo, we have Australopithecus. Then we have genus Ardipithecus. We have Auroran tugenensis. Just gonna get up in here. And we have Sahelanthropus chidensis. And Sahelanthropus is thought to maybe be the last, or I suppose the first actually, the first organism after the split between humans and chimpanzees 7 million years ago. Okay, I'm going to have you lift your tongue to the roof of your mouth. Okay, so no central cyanosis there. How's the floor of the mouth? Okay, and if you could stick out your tongue. But, bipedalism in Sahelanthropus is kind of a messy topic, and trying to find who was the first to start really being bipedal, making great leaps towards it, is difficult. Would you mind saying "ah" for me? Okay, good movement there. You can go ahead and close your mouth. But this fossil found and this paper written about it comes from possibly a Miocene ape called Gryptopithecus. Gryptopithecus. Okay. Right, so pharyngeal wall there is clear, as well as the floor of the mouth, roof of the mouth, our pockets of the cheek. Was found was this excellently preserved femur. I mean, just beautiful, especially for being 7.2 million years old. We're going to move to the chest, and I'm going to do some palpation here. I'm going to feel for heaves with the heel of my hand, thrills with the flats of my fingers here. I'm going to feel over the valves of the heart. So we have this femur and different aspects of the femur, you know, like the head of it, the neck, the greater trochanter, this, that, and the other, were compared to other members like Australopithecus, likely Ardipithecus. I didn't quite get to that chart to see all of it. You know, maybe they did Roran as well. Okay, and the flats of the fingers here. For thrills, those are palpable heart murmurs. And while a lot of what was showing up in this femur suggested bipedalism, we don't have other evidence like the arms, for example, that'll tell us how arboreal an organism is. And the cranium is very important because that'll tell us quite a bit by the position of the foramen magnum, which is where the spinal cord enters the head. So you have humans where spinal cord, head, just like that. And then you have organisms like a cat where it comes in at the side like this. And then you have knuckle walkers, which come in more of an angle. So I can tell you a lot about the locomotion of an organism. I'm going to do some percussion on the chest. So I'm going to put my hand on your chest and just tap along. So I'm just going to listen here, but I'll tell you what the kicker is about this paper in a moment. Excellent. So I'll do some auscultation. So what was odd about this paper is that we're talking about bipedalism in a Miocene ape. Possible bipedalism. But the location of where it was found, that's what makes it interesting, because this was a specimen found in Bulgaria, in Europe. Whereas we think, you know, the prevailing hypothesis was that most of these attributes that eventually become genus Homo, that they all form in Africa. So I'm going to listen to your heart to start. So we'll have the aortic valve here. Listening to it open and close. And then the pulmonary valve. And the tricuspid. And our mitral valve here. Okay, good. Good heart sounds. So let's listen to your lungs. I'm going to place the stethoscope on your chest. I'm going to have you take a deep breath in and out. And then I'm just going to flip to the other side. And then we'll work down, other side, and just work in that ladder-like motion. So, deep breath Deep breath in and out. 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 Deep breath in, out. Lastly over here, deep breath in. Okay, so while I have the stethoscope in, I'm going to listen to your abdomen here. Normal breathing. Nothing different. Good. Just listening across each quadrant. Mm-hmm. Just a couple seconds each. We won't need this bad boy anymore. Okay, so let's do some percussion on the abdomen. So yeah, Bulgaria. Bulgaria is absolutely not Africa, but remember how I said the Pleistocene was also colloquially called the Ice Age? Well, in the Miocene, climate was a lot different, a lot warmer, and there were apes everywhere. Okay, let's go along the liver here. So it makes sense that, possibly that bipedal evolution starts somewhere else, and as the climate changes and cools down, and the forests and that cooler weather, starts up here, and then everybody migrates down to where it's warmer, where the forests still are. Okay. Good. Okay, let's do some palpation here. Let me know if anything's tender, painful at all. Good. So yeah, possibly maybe the start of bipedalism begins in Europe, where it's warm, where there are plenty of apes. And then over time, they come back to Africa as the climate changes. Okay, so let's feel liver here. And the spleen. And the kidneys. Good. Okay. We have some things to jot down now. Good. Okay, normal lung sounds bilaterally. No crackling or wheezing or rhonchi. Stridor. Okay. Tender. No guarding. Okay. Organ size. Okay. Let's finish off by looking at your arms, your hands, your legs, and your feet. So let's just take a look here. Looking at the arm. Good. There are very cool things that we're finding out just this year has been absolute bounty for human evolution news. A lot of papers released. There was something just so mind-blowing when a few months ago, there was a paper on the most complete Homo habilis skeleton found, and we only have like 2 or 3 specimens of Homo habilis, and now you have found the most complete one. Pretty exciting. Would you mind just putting your hands like this? I can look at the nails and the joints, the skin. And I really, really am waiting for postcranial remains of Homo rudolfensis. Homo habilis and Homo rudolfensis have become a bit of a wastebasket taxon, which means that if a fossil is about the right age and its attributes are, similar enough, then it gets put in these species which don't have nearly enough remains for us to really be able to tell, what specifically makes up an organism. Could you please turn over here? And you only have, like in the case of Homo rudolfensis, just like some crania. How do you know when an arm belongs to Homo rudolfensis? How do you know a foot does? You can only really go by age. And Homo rudolfensis was in the same time as Homo habilis. And when do you, if you have something that's older than Homo habilis, how do you know it's not just Homo habilis? Is it a different species? Is it not? So you need a lot more fossils to be able to specifically categorize things. Until then, you've just got to put everybody in a group and do your best. So let's go ahead and just grab our reflex hammer here. This guy, little odd looking. This is a Berliner and tends to be a little firmer than our other reflex hammers, but I do like the shape here. I am going to have you just put your forearm on your thigh, and you're going to have your hand just dangle down, and then we're going to look at the triceps reflex and the biceps reflex here. Okay, this arm. All right, just let your arm relax here. We'll see if our muscles will cooperate here. Okay. Oh, there we go. Good. Now I'm going to put my hand around your elbow. We'll grab our biceps reflex. Okay. Good. You want to go ahead and switch arms? Yep, just like I had you before. It's quite humid. Okay, good. So triceps first. Good. And biceps. Excellent. Let's take a look at your legs here. So, especially the shins. We often get our skin abnormalities. Okay. And any pain or tenderness here? Good. So yeah, should you choose to stay with the clinic here, I'm one of the yappier people, but keeps me on track. But there are other people who want it a little more quiet, and that is just fine. Okay, and can you put your foot up here? Good. Okay, good capillary refill there. And while I've got you here, I'm just going to grab this for our ankle jerk. So I'm going to hold your foot, and you just let it relax. Good. Okay, go ahead and put it down and then pop the other one up. Okay, capillary refill. Not really any swelling, just a little bit, but it's a little late in the afternoon. Probably been on your feet quite a bit, yeah. Yeah, okay. So, just like the other foot, I'm gonna hold it, and you just relax. Oh, not that one. Nope. We'll get there. There we go. There we are. Okay, go ahead and let that go, and then we'll get our knee jerk reflex here. So let the legs just hang freely. Okay. Good. Other side. All right. Good reflexes there. So we have some things to jot down here. Okay, let me just review real quick. Taking quite a few notes on you so that we have something to refer back to as our baseline. There are vitals you got when you were first coming in. Okay, yeah. That looks great. So, did you have any questions for me at all? Okay, all right. Well, if you do end up having any questions, any concerns, anything, go ahead and just call the clinic. We always have somebody manning the phones. They can answer your question or leave a message for me. And I'll go ahead and just sign off here. There we are. Wonderful. So, thank you so much for coming into our clinic today. I really hope that we're able to have a great working relationship in the future. I hope you have a